Hey, thanks everybody. So again, I'm Andy Scott, the program manager for Medic. I'm going to talk a little bit just about what we're going to do in 2022. So what Michelle just gave you was the rundown of 2021, where we stand. Only 1 month left in that performance period. So if you remember, our years run from November 1st to October 31st. So definitely want to back up Michelle's message of finishing strong in 2021. But I'm going to give you just a rundown of what the goals are for 2022. So just a reminder of how this all works. So for our goals, the coordinating center kind of looks at the data, works with the clinical champions and the executive committees to vet targets, use our achievable benchmarks of care methodology, and then present those to the executive committee, work that through with the executive committee. Often, that's a great venue for us to understand whether things are feasible, what the unintended consequences are, and how it feels like these measures will land within your hospitals. And then finally, once we get that work through, the final approval comes from Blue Cross. So just a reminder of how the P4P system works. So in your first year, it's 100% participation. In your second year, it's 30% performance, 70% participation, and then in the final year, well, in any subsequent years more accurately, so year 3 and beyond, it's 70% performance and 30% participation. You can see where your particular site falls in this. We've got most sites at year 3 and beyond now. As Michelle did point out, we've grown a lot, so there are a lot of sites in year 1 and a couple in year 2. And so this is kind of the breakdown of how these years work. So to go through the actual indexes, so for 2022, the pay for performance, so this is for the year 1, remember, 100% participation. And this is actually, I think we've had an orientation meeting with every site that's in year 1, but these are the things that are very consistent for what we've had in previous years. So send your data in time, send your data accurately, come to the meetings, get everybody hired, and then do your intervention templates. So sites that were in year 1 now, I guess 2021, moving into year 2 in 2022, you should have gotten a intervention template from Katie. That's due November 1st, and that's kind of your final thing that you were doing in year 1, 2021, and now you're moving on to year 2. So year 2, very similar participation measures. We don't have obviously the signing contracts and getting people onboarded sections of it, but the same ideas: get your data in time, get it abstracted, come to the meetings, and then do your SNAP review with Carrie and Katie when the time comes. So the important thing for these year 2 sites is now you're moving into your first year of actual performance measurement. So you're going to be graded on 3 different things in 2022. The first one is, and the only one that you'll be working on as a site-specific target, is the chest pain or asthma safe discharge measure. And actually, all of our year 2 sites for next year will be working on chest pain because none of them are the pediatric specific sites. So 10 points available for your chest pain low risk, so that's heart score 3 or less, chest pain patients discharge rate. Then you will be, this is for your first time, you'll be working with the collaborative on our head injury collaborative wide measures. So adult appropriateness and pediatric utilization. So first year on participation, again, it's only 30 points, but one that you'll be working on by yourself with your own data, that's the chest pain work. And then you'll be working with the rest of the group on the head injury for adult and kids. For the bigger group of you, so the year 3 and beyond, this is where we, again, like I talked about, we transition into that 30% participation and 70% performance. So in the orange there, you've got 70 points on your on your performance. If you remember in 2021, the year we're finishing up, that was our all-in for head injury year. So I think at least 50 of our points were on head injury in 2021. So we're kind of, this is in the chest imaging ones, the PE and the chest x-ray we're putting to maintenance. So those are very small points. So the vision for 2022 is to transition back more to kind of the normal way that we were doing things pre-COVID. So putting a big emphasis this year on these safe discharge measures. So like Michelle mentioned, our 2 children's only hospitals will be working on pediatric asthma. That's the time to steroid, or proportion of kids getting steroids within 60 minutes, where everyone else will be working on chest pain. So that's 30 points, your own data, not collaborative, just working on it by yourself. The other thing, like I said, we had PE and chest x-ray were in maintenance in 2021. We're moving those back to the main kind of menu of quality initiatives. So 20 points on site-specific pulmonary embolism or chest x-ray. And you will choose, this is a choice, so this is an or. So in the intervention template that Katie sends out, when you'll send back through Zendesk, you need to choose whether you want to work on PE or chest x-ray. The targets I'll talk about in a minute, but this is one where you do have the choice, but you do need to let us know in November what you're working on for the year so we can set the grading system up for that. And then you'll also be, as year 3 sites, you're in the same pool with the year 2 sites on the collaborative wide head injury measures. So 10 points on adult appropriateness, 10 points on pediatric utilization. And we do use, there's, as Michelle mentioned in those cohort slides, did a really nice job of showing that people are all over the place in their kind of QI journey and where you're at in this. So that's why that achievable benchmarks of care methodology is really important, where we look at how everyone does. We consider everyone that's going to be graded on these measures and come up with a reasonable target for what's a achievable collaborative wide target. So for pay for performance, this is not yet approved by Blue Cross. It was submitted I think that September 3rd, early September was our deadline. So that's been submitted. It's in the review process with Blue Cross. So these are the targets that we did propose to Blue Cross. I think they're kind of logical progressions for where we were in the past. So for chest pain, the proposed target is 90%. It was 88% in 2021. So that's a little bit of a step forward. This is the first time we've ever graded the percentage of patients getting their steroids in 60 minutes. So using the same methodology, looking at all sites, 66% is the target for that. For the collaborative wide adult minor head injury, target is 57%. It was 55 in 2021. So again, nice kind of logical incremental progression in those targets. Pediatric head injury is actually the same as it was in 2021, 18%. We're adding a lot of new sites, so the way the data shakes out can be kind of unpredictable. And then for both PE diagnostic yield and chest x-ray, as a reminder, those were in maintenance in 2021. So what we did in 2021 was take the 2020 targets and ease them by 10%. So if you'll kind of remember, PE in 2021 is 9.9%. Chest x-ray in 2021 is 27.5%. So what we're doing now is we bring these 2 measures back to kind of the center of the menu, is taking those and taking it back to the 2021 or 2020, excuse me, targets that we had when those were back in the limelight, for lack of a better term. So we do recognize that these are both measures that have been affected by COVID and the diagnosis that comes around with that. It's been hard to kind of tease that out of the data, in all honesty, with some of the holes that we've had in the data. But we feel like bringing it back to the center of the stage and back to the targets we had in 2020 was the right next step for pay for those measures. Okay, so that's the pay for performance. So for the VBR, the value-based reimbursement, this program has evolved quite a bit in the last couple of years. It feels like Blue Cross is put a lot of emphasis on this is something that feels like it's motivating to a lot of sites. So there's some different options of how we do VBR. In the past, really 2020 and before, what this category 1 was the only VBR we had, this 3% collaborative wide VBR. Now we've got these 2 other categories, which I'll talk through here. So the kind of classic category 1 traditional VBR, 3%, this is a collaborative wide measure. Everyone's in it together, either everyone that's eligible either gets the incentive or does not get the incentive. So it's an all or nothing team sport type of deal. So the targets for those, and we're sticking with head injury for those, adult head injury and peds head injury. These targets are actually a little bit, I guess, easier and a little, I guess, easier. I don't know if easier, right? But they're lower numbers, more achievable than the P4P targets. And that's because with the growth we've had and with the different participation models that we have between physician organizations and hospitals, the group of hospitals participating in these measures, P4P versus VBR, is quite different. And that hasn't really been the case in the past. So I do occasionally get questions, why is the P4P number different than the VBR number? And the answer is that it's just different participants in those. Okay, so summary, type 1, everyone in it together, collaborative wide head injury initiatives. Category 2 is an extension of what we did this year with the Tableau reporting. And so this in 2021, this was 100% participation. You signed up, got your account, filled out the survey, you got your points. This year it is moving towards a actual performance measure as well. So the participation measure will be that the individual physicians will need to sign up for an account on our registry, which most of them have already done if they participated in 2021. And they will individually need to meet one of the two head injury targets. And again, and a couple things to stress on this is that this is 100% at the individual level. You don't need to have a certain percentage of your faculty signed up. People either do it or don't if your hospital is eligible. And you know, we're working on providing you with better reporting to let you know who's done it and who hasn't. But from a system level, this is optional. Your individual folks, if they sign up, do the work, they get it. If they don't, they don't. There's no thresholds for that. The third one, the final one, is one that has come to us pretty recently. This is part of an initiative that's being spearheaded by one of the new CQIs that's kind of in development within the Value Partnerships world, which is the health behaviors. And they're setting a goal of reducing smoking in the state of Michigan pretty significantly. And Blue Cross has offered the opportunity to at least discuss figuring out how each CQI can participate in reducing smoking in the state of Michigan. So this is very early. We talked about this a little bit at the Clinical Champions call a week or two ago. This will be 100% optional. Really, probably initially just around the idea of, can you figure out what the smoking status is of your patients, and can you figure out if there's any sort of smoking cessation counseling, anything like that occurring. So the one big plug I did want to put in with this is that if you feel like this is something that your site kind of resonates with you or would be something that would work well for you, reach out. We've got a couple sites that reached out after the Clinical Champions call, but reach out to me, reach out to Keith or Megan, and let us know that you're interested, because I think this is a very, it's an evolving thing that we're trying to get right. And there's there's a lot of hurdles in what emergency medicine can do about smoking, but it's something that's got a lot of weight behind it and a lot of push behind it, motivation from both the CQI world in general and Blue Cross. So we're trying to figure out how to be good participants in that. So if there's something that you're interested in, please let us know, and we'll loop you in as we probably in the next couple months get to the point of figuring out how this is actually going to work. So I guess just in summary on the VBR, 3 different types of VBR. 1, kind of the normal collaborative wide head injury work. 2, individually working, sign up for the registry, get an account, meet your own performance metric. And then 3, a lot of details to come, smoking cessation. We'll figure it out together. All right, so what questions? Any questions? No questions. Okay.